informing how the care is designed. They're also informing the fact that they've been open on weekends and evenings far before anyone else was. We see these minute clinics opening in Target and Walmart. That didn't happen in a lot of these community health centers because the patients said, we need to have you open when we're there. The other thing that I think is critical in the success that community health centers are having in reducing disparities is, as you pointed out, those ancillary services. Community health centers provide transportation services in places like Loudoun County, Virginia, where that's critical to get to the place where you need to go. And the translation services, also critical. So because of those things, we've seen many successful models of where those disparities were virtually eliminated because of that. In addition, kind of getting to your other point, I think because of those reasons, we've seen far fewer, lots of success with decreasing ER visits and unnecessary hospitalizations, in part, again, because the clinic is there, you've established a relationship, and we know primary care is so much about establishing that relationship and feeling like it's your center. Once that relationship's there and the trust is established, you go back to them before you might call and go to the emergency room and have that unnecessary visit. We know that about 17% of rehospitalizations are completely unnecessary, and 50% of them never saw a physician or a provider after they were discharged. You let them out of the hospital and then they're just off. So to be able to bring them back to a place where you've got this relationship is one of those things that's going to help bring down costs ultimately.
Thank you. Great, thank you.
Hey, Bernice.
By the way, one of the 3 nurses in the House of Representatives.
Thank you very much. Let me thank Rosa and George Miller, Karen Bass, for putting this together. And thanks to all of you and all of my colleagues who have come, because I know how busy all of us are. I'm from Dallas, Texas, the fastest growing area in the country. Yep. And many of our people who are coming are not English speaking. And most do not have health care. But we have a very sensitive administrator for our public hospital, Dr. Ron Anderson. So I have worked with him, and we've put a lot of community health centers around. And what we have found is that people will more likely go because it's closer to where they are. They're not threatened with lines that are going to last a couple of days. And they have friendly people in the neighborhood who are there. And nothing has been more important than those electronic records. Right. Dr. Cole, I've heard you make that presentation before. Because sick care in the emergency room is very expensive. And yet that's really what we were faced with. And since we have tried to get a handle on this, we have a network now throughout the Dallas-Fort Worth, North Texas area that's connected. And it has made all the difference in the world. It has saved tremendous dollars. And people are learning to be self-reliant. They're learning to take care of themselves because they have time in community health centers to teach them. But when you go to an emergency room in a diabetic coma at 3 a.m. and nobody knows who you are and you don't have a doctor, can you just imagine all the tests that have to be performed before they can determine what's wrong? And then the next time, that same patient won't go to the same hospital. They'll go to another one because they're afraid because they don't have the money, they won't be treated. When you can connect that, it makes a lot of difference. There has been nothing here that I have participated in that's been more important to me than having the opportunity to vote for this health care bill, because it has done more for the American people than any other piece of legislation that I know in this year, and it will even do more. And so I applaud all of you for helping us to continue to improve that care, because you're in the field. You know what works, and when we can help, all of us here are willing to do that. Dr. Cole, I don't know you personally, but I've heard you before. I so appreciate what you're doing, because nothing is more threatening to a patient than to be in a rural area, not near a hospital, and have something happen, and nobody in that family know what it is. And so thanks to all of you and for coming. I don't have a question. I'm a nurse by profession, and I served in that capacity a long time before I came into politics. Been a nurse over 50 years. Thank you.
Thank you.
Thank you.